A hernia occurs when an organ or tissue pushes through an opening or weakness in the muscle or surrounding connective tissue that holds it in place. The most common type of hernia is an inguinal hernia, which occurs when part of the intestine or fatty tissue pushes through the abdominal wall or into the inguinal canal in the groin area. Other types of hernias include femoral hernias, hiatal hernias, umbilical hernias, and incisional hernias, all of which occur in different areas of the body. Hernias can vary in severity, and they may not cause immediate symptoms. In some cases, they may be painless and only noticeable when a bulge is observed in the area where the hernia occurs. In other cases, hernias can cause discomfort or pain, especially when coughing, lifting heavy objects, or performing other physical activities. A hernia can also be associated with symptoms such as swelling or a visible bulge, particularly in the abdominal or groin regions. Inguinal hernias are among the most common types and affect both men and women, though they are more common in men. This type of hernia occurs when a portion of the intestine or fatty tissue bulges through the abdominal wall or into the inguinal canal, which is located in the groin. While the condition can be present at birth, it is more commonly acquired due to factors like increased pressure within the abdomen, which can be caused by activities such as heavy lifting, chronic coughing, or obesity. Another type of hernia, the femoral hernia, is less common and typically affects women more than men. It occurs when fatty tissue or part of the intestine pushes through the femoral canal, located just below the groin. Although femoral hernias are relatively rare, they tend to be more dangerous than inguinal hernias because they can lead to complications like strangulation, where the blood supply to the intestines is cut off. Hiatal hernias occur when part of the stomach pushes through the diaphragm, the muscle that separates the chest from the abdomen. This can cause acid reflux or gastroesophageal reflux disease (GERD), leading to symptoms such as heartburn, chest pain, and difficulty swallowing. Hiatal hernias are more common in people over the age of 50 and those who are overweight, but they can also develop as a result of injury or increased pressure within the abdomen. Umbilical hernias are often seen in newborns, but can also affect adults, particularly those who are overweight or have had multiple pregnancies. This type of hernia occurs when part of the intestine or fatty tissue pushes through the abdominal wall near the belly button. In newborns, umbilical hernias typically close on their own as the child grows, but in adults, surgical intervention may be required. An incisional hernia occurs when tissue pushes through a surgical incision or scar in the abdominal wall. This can happen after abdominal surgery, especially if the incision does not heal properly, or if the person puts strain on the abdominal area too soon after the procedure. Incisional hernias can also develop in individuals who have had multiple abdominal surgeries or those who are overweight. While hernias can sometimes resolve without treatment, many cases require medical intervention. The primary treatment for hernias is surgery, especially if the hernia is causing pain, discomfort, or complications. The goal of surgery is to repair the opening or weakness in the muscle or connective tissue and return the organ or tissue to its proper position. There are two main types of surgery used to treat hernias: open surgery and laparoscope surgery.